So the current guidelines and definitions are based on two main biomarkers. First is the bone marrow infiltration percentage if a bone marrow biopsy is done for MGUS or smoldering patients. And the second one is the monoclonal protein through like serum protein electrophoresis, or what we call SPEP. So the definition of MGUS, if patients are having less than 3 grams per deciliter of M spike and less than 10% plasmacytosis in their bone marrow, then we define them as MGUS. However, if like either of these conditions are not met, then we define these as smoldering multiple myeloma. We are now in the field, and multiple groups are trying to characterize it even better by looking at the genomics and the molecular characteristics, and so that we can identify high risk or different risk stages within smoldering myeloma specifically. We published work like a year ago in Nature Communication talking about like molecular subtypes in smoldering myeloma, and basically it was like the largest study to date, including 214 patients from multi-centers, and we looked at both the exome and RNA sequencing data of these patients to try to have kind of a classification or a taxonomy of different subtypes and how their clinical outcomes could be also different and distinct from each other based on the molecular differences. So we found that there are 3 molecular subgroups. We categorize them as high risk molecular subgroups. These were enriched in like multiple known like molecular abnormalities in myeloma, like 413 translocations, 1Q, some mutations like KRAS or TP53. Each group like had in the high risk had similar outcomes in terms of time to progression to active myeloma and requiring treatment. The other 3 subgroups had actually significantly lower and or better actually time to progression in terms they progress in a very long time compared to the other patients who progress in a short time. And we found that even on the gene expression level, that these are different and they activate and upregulate different pathways that are known to be implicated in the myeloma pathogenesis. So this was a step, and other groups are also working on similar findings to better characterize specifically smoldering myeloma and who are the patients who are at a high risk of progression. And this, we also validated it in another cohort from NYU and Mayo Clinic, and it was actually, we found that the results are still consistent. So we are excited to add this knowledge in the field of smoldering myeloma, that we now know some molecular characteristics that are very highly correlated with progression and worse outcomes.